More horror stories are emerging of unclean and inadequate staffing conditions at Sydney's Royal North Shore Hospital. Pressure is now mounting on the state government to resolve what's being described as a debilitating situation. The minister's now recruited a former health executive to help lift hygiene standards. The dispute between the cleaning contractor Infrashore and the Health Services Union is back in the Industrial Relations Commission tomorrow. Louise Negline reports.
Craig Gordian says he needs another operation to treat a chronic pain condition, but says he can't go through with it after his experience at Royal North Shore Hospital.
I was told by the nurse that they didn't have any bottles and that I either was to urinate in the nearby sink, standing on my knees and urinating in the sink, or I was to get out of bed and walk to the nearest ward, which I was then informed was the infectious disease ward.
He says conditions were so bad he discharged himself 24 hours after surgery on his spine.
I found the hospital very dirty, and that's why I left.
There are more beds since a public-private partnership took over the hospital's redevelopment, but no extra staff.
So the contractor was expected to still deliver all the services, even to the expanded areas, without any extra remuneration.
Judith Cager says the current situation is unsustainable.
Accumulated dirty linen isn't being removed frequently enough. Bins are overflowing.
The Nurses Association says at times only 4 cleaners are rostered to clean the whole of the hospital, and during night shift only 2 are rostered on. Pressure is mounting on the Health Minister to take action.
The Minister needs to intervene today, sit down and resolve this problem so we don't see patients left waiting in corridors for hours.
They don't like it, do they? They don't want to be held to account for the mess that they have left us.
The Minister says patient care is being prioritised and that infection control processes are being properly managed. The Health Department says 20 extra staff have now been employed to lift standards at the hospital. Louise Negline, ABC News, Sydney.